Good afternoon. My name is Katie. Thank you so much for taking the time to speak with me. I've been a nurse for over 5 years, in most of that time in the emergency department in a county facility, a county hospital. I'm currently working on my master's in nursing administration so that I can help create a better environment, give fellow nurses the tools they need, and empower them to provide the best patient care. So I'm here to talk to you today about community health centers. I'm concerned about our decreasing and unsure funding, federal funding for the community health centers and the impact that will play on our Texas residents. Community health centers provide primary and preventative care as well as access to critical care to thousands of Texas residents yearly. Without funding for community health centers, these patients are losing imperative care that helps them learn about their diseases. With early prevention and screenings, they can catch diagnoses of illnesses earlier on and then learn how to manage their diseases. They can learn about healthy living, lifestyles, medication adherence, compliance, and this overall will help decrease funding later down the road, the cost of health insurance, healthcare spending, because when patients know how to take care of their diseases, when they're given that primary and preventative care, they're given that patient education, they don't show up to the emergency room with non-emergent and non-urgent care that ends up costing the hospital and the patient a lot of money. Are you worried as a state representative? Are you worried about the funding and the lack of funding for our community health centers and what that could mean for our facility?
Sure.
Absolutely. That if we lose funding, that could put a lot of people out of work, and then think of all the residents that will no longer have access to that health care. That also affects children. The children that use children's health insurance, the program CHIP, all go to community health centers for their primary and preventative care. So by cutting funding to community health centers, we're also affecting the lives of thousands of children that they don't need to be caught up in that. We need to provide a better tomorrow for them. So I really look forward to working with you on this issue. I hope that we can work together to increase funding for community health centers, and I really appreciate you taking the time to speak with me. Thank you very much.
You're welcome. Thanks for coming by.